Well, hi, everybody, and welcome to this afternoon's commentary session. I'm Barnaby Page. I'm the editorial director at ECigIntelligence and Tobacco Intelligence. And I have with me today Sam Tam, who's from the Canadian Vaping Association, and also Jeannie Cameron, who many of you will have heard just now, giving chairing a really fascinating session on the FCTC 20 years later. So a couple of very different perspectives here. We have Jeannie, who's come largely from a government position. Sam, who's coming very much more from the sort of consumer advocacy end of the vaping world, of the THR world. So let me start off, guys. I know we're only sort of halfway into the first day of the full session. But let me start off with a general question. What are your takeaways so far from GFN? Jeannie, maybe you'd like to start.
Oh, I think probably the takeaway so far was listening to, just a reliving of some of the history that Derek Yak was speaking about at the start of the FCTC, and also Professor Kayat from France, who was speaking about the Charter of Paris, two very different multilateral agreements, but one that looks at a very humanitarian approach to cancer and death and disease and involving and thinking about the patient, and one that's very clinical, the FCTC, that, sort of says quit or die in essence. And, I found that very interesting. I mean, I also found the talker from Canada who was doing the keynote this morning, some of the things he was saying were very profound and putting things into language that were an example of what really is going on at the coalface and how to interpret it. So they're the only two things I've seen so far, so that's all I can comment on.
So two things, they're both highlights, great.
Yes.
And yeah, I mean, totally right. I thought one of the most interesting things in that FCTC session was about the history of it, and particularly some of the points made about Article 5.3 and the article itself versus the elaboration or guidelines to the article. And a lot of the sort of fears we have about Article 5.3, actually, it seems, exist in the guidelines rather than the article itself.
Well, the legal obligation for the governments is actually what is written in the treaty.
Yep.
The guidelines are only guidelines that you may or may not want to adopt, and I think it's reminding them that that's their obligation, not what everyone else wants.
So, Sam, enough of me. What about you? What were your highlights?
I think the emphasis that we need more tobacco harm reduction research, especially in countries with low to middle income countries. There's more information. I would say, we've seen globally there's a lot of misinformation being spread around about vaping and the harms of vaping. But in essence, I think more work needs to be done. Misinformation needs to be addressed. And I think there's a great opportunity for that. And I think meeting with a lot of different people from different countries and associations, I think we can help one another and stop some of the misinformation being spread about vaping.
Sure. Well, that's been a pretty consistent theme, I think, of GFN for some years. And of course, it is the Global Forum on Nicotine. It's not the Global Forum on e-cigarettes or pouches or tobacco-heated products or whatever. But one of the problems that a lot of people in this space face, of course, is that conflation, that confusion between nicotine and smoking. Very much in the eye of the public health community, sometimes in the eye of regulators, and of course in the eyes of the general public. So, I mean, coming from it at your point of view, Sam, from an advocacy point of view, how do we correct that? How do we address it and let people understand that nicotine in itself is not really the issue here? Smoking of combustible products is the core public health issue.
And we always have this conversation, right? It's not, people don't die from nicotine. It's they die from the combustion of tobacco. And it's important for us, to highlight that, when we talk about substance use, which is mentioned over and over again at GFN, is, what are the key points to addressing people consume, nicotine, for instance, because they have an addiction. And I think it's important to highlight there are safer alternatives out there for them. And I think it's important for us to highlight the importance of harm reduction in general, whether you're using vaping, whether it's nicotine pouches or snus. And I think government needs to change their position and to promote harm reduction alternatives.
Sure.
And in Canada, I just want to highlight Canada's moving towards that approach, right? They're incorporating harm reduction as part of their tobacco strategy of reaching a less than 5% smoking rate by 2035.
Now, just to follow up on that for a second about Canada, is that something you think that is coming from, if you like, the traditional tobacco control community within the Canadian government? Is it something that's coming upwards from the world of consumers? Is it perhaps something that's coming from the harm reduction movement elsewhere? Of course, harm reduction began very much with HIV, injectable drugs, and so on. Has that kind of informed those decisions?
Well, I think Canada is unique because there is a bit of a divide between our government and tobacco, or I would like to say nicotine control groups, as we like to refer them to now. They don't, their position's different. They don't believe in, harm reduction. They believe you either quit or you die approach. And that doesn't work today with our government. So there is constant struggle between government and those groups, including health organizations. But I think, the position is clear. Canada wants to potentially be the third country in the world to be smoke-free. So they've changed their approach in 2023, and I think that's the course that they want to take.
Great.
I think there's some interesting analogies at the multilateral level when you look at this and what you were saying on tobacco harm reduction. You look at the Framework Convention on Climate Change and the Framework Convention on Tobacco Control. They're both very similar in multilateral conventions, about 10 years apart. And yet the world is very happy in the energy industry to look at all the harm of fossil fuels and a move to renewables, which are less harmful in terms of the environmental issues. But when you look at our issue, which relates to smoking and moving away from smoke to less harmful forms of nicotine, it's not embraced as universally as it is with the Framework Convention on Climate Change's treaty. So I think that's really interesting. And also I think what you were saying about nicotine, I do think in the future, the way governments look at nicotine, when you look at its therapeutic benefits, which is something, it's emerging to be spoken about, but the benefits in terms of its cognitive benefits, reduction of, it was certainly used for Parkinson's disease, certainly being looked at in terms of Alzheimer's dementia. It's used for Tourette's. It's used for many sort of the big global issues where nicotine has an impact, so long as it can be disassociated with smoke, which, as you said, is what is doing the harm. And we know that's the harmful thing. So let's get rid of the smoking, but keep the nicotine. Well,
absolutely. I mean, to quote famously Michael Russell, who is, of course, the guy after whom, the oration at GFN each year is named, people smoking for the nicotine and dying from the tar. But Jeannie, I wanted to ask you something specifically about government perspectives on this. And let me give a little bit of background first on some research we've been conducting. For some years at Tamarind, the publisher of ECigIntelligence and Tobacco Intelligence, we've done surveys of MEPs, members of the European Parliament, on their attitudes toward novel nicotine products in general. And there's quite a range of attitudes, as you would imagine, and these vary to some extent according to political affiliation, according to what kind of product you're talking about, etc. So it's not a wholly clear-cut picture. But one thing that does emerge very clearly from it, time and time again, is the more people know about these products, the more sympathetic they are. Opposition, to a large extent, seems to be bred out of ignorance, or perhaps ignorance is bred out of opposition. It could work that way as well. Now, you, of course, have worked in government in Australia. You've been very close to government-level policy making through things like the FCTC. And I believe you now, in fact, are a parliamentarian yourself in Alderney, in the Channel Islands. Is that right? So is that your experience? Is opposition uninformed? Is that the simple problem?
I think when it comes to the UK, for example, anywhere really. I think most politicians have a lot to do. They're very busy. They're going from thing to thing very quickly, and so to get the depth of understanding that is often needed in areas like this, it's going to take a bit of time. So unless they have an advisor or someone who's giving them a briefing from their departments, the relevant departments, that is well informed, they're really not going to get that information. Politicians very often are driven by what they see in the news, in headlines, and as we all know, especially in this area, it's probably the same for almost every area that we don't have the depth of understanding about. But in our area where we do have the depth of understanding, you see the headlines, you know a lot of it is junk news and not true and not based on any science, but that's what they're hearing and that's what they then take away. So I do really think, as been spoken about earlier today, the education of getting things into politicians before the issue comes across their desk or before they have to do it is very, very helpful to broadening the debate and getting out the issues better understood.
Sure. So let me follow up that, Jeannie, and then we'll get Sam's perspective on this as well. Let's just imagine that you had, that you were given the task of changing the minds, or at least improving the attitudes, shifting the attitudes of policymakers. How would you practically set about it? For example, would you go through consumer organisations? Would you go to the media? Would you go to politicians directly?
Well, I think you certainly need a bit of all of those things. However, when I look back to early days when I was a political staffer, one of the things when I worked for a cabinet minister for telecommunications, and I remember him coming out and he said to me, I've got to go into the chamber this afternoon and I need to know what to say on how to privatise the spectrum. And I kind of went, oh, and I looked at him. For a start, I didn't know what the spectrum was, let alone how to privatise it. We're talking the 1990s here. And so what I did in those days, because it was before the internet, we didn't have Google or anything, I went to a filing cabinet and found what had been submitted to us. And I found a paper that had been written from someone about this particular thing. And that became what I then wrote about. So to draw that to this, I think, in my view, it's not waiting until things come up like tobacco and vaping bills in the UK or somewhere else. It's about constantly always finding reasons to educate whoever is the relevant decision maker and the policy makers who, or the advisors to the policy makers, and really doing a proper stakeholder map, seeing who are all of the relevant entities that may have an impact on any decision that you think is relevant, and gradually just educating them over time. So when that moment happens, well, they can go to Google these days, but when that moment happens, they have something already sort of formulated in their head, rather than just always waiting for, oh, we now have this we need to react to. Because you're not going to get in. It's a slow building up, and I think that works generally in my experience on any issue, really.
So it's being proactive and laying the groundwork rather than just firefighting, as it were.
Yes.
Now, Sam, you've obviously been involved in a very hands-on way in things like this. In Canada, how has it worked for you there specifically?
Well, in Canada, we engage government quite often, and I think it's really important when we talk about education is there's a lot of misinformation, as I mentioned. Sometimes when we meet with government, they don't have all the information that they need, and they do require education. And a lot of times, the information that's being given to government is not necessarily accurate. One of the things that we found is that every federal government agencies don't really talk to one another. Right, their own different departments, they're in charge of different things. So when it comes to taxation with vaping, excise taxes, finance doesn't talk to Health Canada. And what we've done over the years is really to have that, put that alignment together, getting all stakeholders involved to talk and to create better policies. We've been very fortunate enough to, our association meets with the government on a quarterly basis. And we have these discussions about policy and how we can focus on harm reduction, how we can focus on better, sensible policies to ensure that we don't over-regulate. And that's one of the major concerns that we're seeing from all over the world is over-regulations, right? Yep. Regulations that stifle innovation, regulations that stifle harm reduction. And we need to make those changes. And I think there's an opportunity for other countries to do the same work that we're doing here in Canada, which is really to to engage government and present to them there's a need between private and public sector to work together. And what was mentioned earlier, when I heard about the Interpol, not being able to attend WHO, which is quite really interesting, is because, our organization works very closely with the federal government on matters of illicit trade. And we work very closely with the RCMP, with Interpol, with the Canada Revenue Agency, with the Canada Border Security Agency, and even with U.S. Homeland Security. But there needs to be a partnership between private and public sector in order to have better policies in place.
Sure. And let me just ask you about the WHO as well. Now, of course, Jeannie has just chaired quite a long and fascinating session about the WHO, as we said. I think it's generally sort of taken as read that the WHO has a fairly substantial input into at least the philosophy behind THR regulation in lower and middle income countries, if not the actual details of the implementation always. Do you find the WHO and specifically the FCTC are a factor in Canada?
It's interesting. I always read the Article 5.3 when I meet with government, but I think there is a mutual understanding from our health agency that we, as whether it's the vaping industry or the tobacco industry, we will always be called upon to the point that there's information sharing, right? When there's updated new policies or new regulations, that we do our best to educate the industry. So there's an understanding where, everything, we do the normal disclosures, but I think there's a government understands that, if there's any issues, that we need to involve all stakeholders.
Sure. And Canada was, in fact, I'm not sure if you're aware, the government that stood up at one of the COPs to try and stop what the WHO was doing in closing the public gallery. So Canada spearheaded, it's a public right, and we, as the Canadian government, cannot say to Canadians that you can't sit and watch us do our policy work in this sort of sense. And they were but as I mentioned in that talk, there was no other governments that supported Canada's position, but Canada did lead that. It's done quite a few things over the last 20 years, both positive and negative, but more positive than negative from the government perspective.
Sure, sure. Well, we're coming close to the end of our time now, so I'd like to have a couple of really quick questions to end up with, like just a minute each. Let me start by asking, perhaps Jeannie, go first. What are you hoping to learn about most at GFN this year?
I think what I'm hoping to learn about, there's a lot of new things emerging, like, for example, synthetic nicotine. I find it fascinating. I think it's a really interesting area because it is definitely not tobacco. And if there was a session earlier which I heard about, where they make the synthetic nicotine via a biochemical process, and it has all the properties of nicotine, but it isn't actually from a tobacco plant. And I think that's the area I'd like to learn more about, because then you can genuinely say that your product is tobacco free. And then all the ESG stuff about the carbon footprint that comes from it, I think that's an area I'd be really interested to learn a lot more about.
Great. So synthetic nicotine.
I think for me, this is my first time at GFN, and I really want to learn from everyone's experience and meet as many people as I can. When it comes to synthetic nicotine, is definitely a very interesting topic. We've seen that start to actually, we start seeing a lot of products that are being manufactured globally around the world are using synthetic nicotine. And I think I'm interested in learning what additional innovation that the industry is creating, because we are vaping. Vaping and any safer nicotine products. There's a lot of innovation involved in it. So I'm here to learn more and hopefully meet new colleagues and friends that we can share our experience together.
Great. And of course, in addition to synthetic nicotine, we now have as well the emergence of nicotine analogues, which are not strictly speaking nicotine, but if you like, nicotine substitutes, which may well be a topic to take up with some of the scientific delegates here. So from my last question, we've got about 3 or 4 minutes left, I think. I'd like actually to go back to the title of today's opening session, What's So Scary About THR? And actually, I'll give my answer first. What's so scary about THR? Well, I'd simply knock the HR off there and say it's what's so scary about tea. People confuse tobacco harm reduction with tobacco. That is the essence of the problem. For many, many years, for decades and decades, from the late 19th century to the early 21st, really, nicotine was synonymous with combustible cigarettes. You couldn't have one without the other, to all intents and purposes. But maybe you don't agree with me. Jeannie, why don't you think what's so scary?
I do think the word tobacco in tobacco harm reduction is scary, because people who aren't as well associated with us, they hear tobacco and then to sort of harm reduction, then it's like, well, what is that? And even when I was checking in for my flight here, had this discussion with the lady, and I spent the time educating her. I got out some nicotine pouches and showed her, and but people just don't know what tobacco harm reduction is. So maybe we need to, the nicotine benefits or something else, or some other form of way to describe it. But it's not a scary thing once you understand it. When you put the analogies, like I said, with the fossil fuels, to renewables, when safe sex, condoms, all that sort of thing.
Sure.
It's not scary when you explain it.
We could call it nicotine harm reduction even, couldn't we?
Yes.
Sam?
It's interesting. I agree. I mean, tobacco harm reduction isn't scary. Canada's always been doing a lot of things very interesting. Canada never uses the language tobacco harm reduction. In a lot of the discussions with government, we've changed the concept to harm reduction, or a lot of less harmful alternatives. And even if we look at the new approach from Health Canada, they've changed our tobacco strategy to include harm reduction and smoking cessation side by side in regards to helping Canadians reduce smoking rates. So, and they mentioned their vaping, any tool that's harm reduction in their category, including vaping. They encourage Canadians to use less harmful products. So it's not scary. I think for Canada, we understand that concept. And I think it's important that, Canada should be speaking up more and talk about their approach and what the government's doing. And I think it's something worth celebrating. One of the important initiatives that I talked about that the government just recently launched was really a new youth prevention and education campaign, because the government understands that a lot of times youth are vaping because of social pressures, experimentation, stress, and all these issues. And the government's moving towards more focusing on prevention and education. And that's how we're going to reduce youth vaping rates in our country. So we're excited to support that initiative. And I think, tobacco, harm reduction isn't scary at all, but, I think, the word tobacco is probably the issue.
Absolutely. Yeah. Hence the Global Forum on Nicotine, not the Global Forum on Tobacco. Well, our time's up, I'm afraid. We need to get back, obviously, to the main program in the conference rooms now. So thanks very much, Sam. Thanks, Jeannie, for joining us. And I believe the commentary teams will be on screen again later.